Welcome back. There is a less invasive option to total knee replacement, and it's allowing many to live pain-free, active lives for the first time in years. And here with more is orthopedic surgeon Theodore Hofstedt. It's good to see you, Dr. Hofstedt.
Nice
Thanks
to
for
see you,
joining
Lisa.
us this morning.
Thanks for having me.
All right, we were talking about knees, and it seems like a lot of people I know, especially men, 45, 50, are having a lot of knee issues, and they should wait. Historically, 40 to 60-year-olds should wait for surgery. Why is that?
Well, when we're talking about knee replacement surgery, we're putting in an artificial implant.
Right.
It's a machine part, and as we know, machine parts can wear out. So if you're young, it's going to wear out before the end of your life. You want to be able to do something less invasive that's going to be a stopgap to get you to the point where you can do a knee replacement that's going to last the rest of your life.
I understand. Now, this is kind of a model of a healthy knee. We're talking about resurfacing. Tell us kind of how this works. This is most people's healthy knee, correct?
Correct. Let me just show you real quick.
Okay.
So a normal knee, this is the kneecap, and this is inside the knee. It's covered by cartilage, and the cartilage is like a Teflon coating, okay? And unfortunately, with age, sports injuries, so forth, this Teflon coating can wear out. It's like a street. The street can get potholes in it or get very rough.
Okay.
So what we need to do, what we've historically always done in these patients, is totally resurface that cartilage with a knee replacement. Now this is a total knee, and it requires coming in and cutting off all the bad cartilage or Teflon coating and then implanting the new coating or the knee replacement.
I see.
We do that both on the thigh bone and the shin bone as well.
Okay, so they get whole new parts, basically.
Whole new parts.
Okay, and that is called?
A total knee replacement.
Total knee replacement. Okay. So knee resurfacing.
Knee resurfacing is a less invasive procedure. You can see the knee replacement here. You just replace a portion of the worn out cartilage. So again, going back to the road analogy, if you have a pothole, why not just fill in the pothole instead of tear down the whole road and give a whole new road?
Well, yeah, that makes sense. And if this is good here, why would you get rid of that if you have good knee cartilage on that side?
Exactly. And I think the most important thing about this is that when you do this surgery, you retain the cruciate ligaments. Everyone's heard of the anterior cruciate ligament, posterior cruciate ligament. And when you retain those ligaments, you retain special nerve fibers that give what's called proprioception. That's the ability to sense where your knee is in space. When you do a total knee replacement, you sacrifice those. So my patients say, well, my knee feels better, I have less pain, but it does not feel normal. With a resurfaced knee, my patients say, my knee feels normal.
And we've got some pictures, too, of, I think, surgeries. We'll take a look at the first one here, kind of give you an idea. Now, what do we have here? Here's the benefits you were talking about the resurfacing, right?
Correct.
Talk about these two different knees, obviously.
Well, on the left is a total knee replacement, and you can see there's a lot of metal in there, a lot of resurfacing. On the right is the arthrosurface resurfacing, and you can see the metal implants very small. It takes a very small portion of the normal bone. And the advantage of this is for a stopgap.
Yep.
That someone can, when they're younger, can get this. This can last for 5 to 10 years, possibly more, until somebody's old enough to get a total knee replacement.
I see. Now, what about the downtime when you get just a partial versus a full knee replacement? Are you back up on your feet quicker with just a resurfacing?
Much quicker.
Okay.
With a total knee replacement, typical hospital stay is 3 to 4 days. With this resurfacing, 1 to 2 days. My patients often can walk out of the hospital without a walker or a cane. And typically they're back to work if they do an office-type job, more sedentary-type work, and back to work in a couple weeks. And even somebody who's heavier worker, such as an electrician, can be back to work at 6 weeks.
And you were talking earlier, too, we mentioned that people who have knee problems, especially 40 to 60 years old, they urged, to wait to get the knee replacement, but this you can get when you're a little bit younger because it'll buy you more time, as you said,
Exactly.
Right? So you can get it done now and then alleviate that pain that you might be having.
Correct.
Wow, very interesting. It seems like more, you were talking earlier, it seems like everyone I talked to has some sort of a knee issue, and you said, yeah, it's a lot more prevalent now with people with sports and as you get older.
Well, a prime example, I met your husband right at the break, and Bruce is having knee problems, and he's treating it conservatively now with injections, but this may be something he may need in the future.
Absolutely. Thanks, doctor. Really good information out there. And I know a lot of people are suffering with knee problems, so this might be the answer for you because you've been waiting on that full knee replacement. And if you want more information about the knee resurfacing, you can go to arthrosurface or arthrosurface.com. There is a phone number right there on your screen. Thanks again, doctor, for explaining that.